Representative Sharon Cooper chairs the Health and Human Services Committee, one of the busiest committees in the House. She was also appointed chairman of the Special Committee on Certificate of Need, as well as chairman of the Special Committee on Grady Hospital. Representative Cooper is a champion for prevention and extremely knowledgeable about the field of substance abuse prevention.
Good morning, everyone. I'm State Representative Sharon Cooper, chairman of the Health and Human Services Committee in the Georgia House. And let me start off by singing your praises of the fact that you work in helping prevent young people and young adults from becoming addicted to substances, whether it's alcohol, marijuana, drugs, smoking, or that you run a program that if they are already started down that path, that hopefully by early intervention, you can stop it in its tracks before it becomes a serious life-threatening addiction. I cannot thank you enough. So often people look to the legislature to solve all the problems and think that we can pass bills that will, take care of the problem, and we can't. On this drug problem across our state, it truly is going to be a person-to-person solution, I believe, before we ever get it under control. Now, of course, sometimes we do things down here that I think could, make things a lot worse. We have a bill moving now that would allow nurse practitioners and PAs to prescribe Schedule II drugs. I'm dead set against that, not because I'm against nurse practitioners or PAs, but because in the times of an epidemic that we have, I don't think it's a good idea to put over 12,000 more prescribers out there writing prescriptions for Schedule II narcotics. I know they have those privileges in other states, but I would say probably some of those states would like to take back that privilege. The fewer people writing prescriptions for narcotics, the better off we are. But of course, we're also seeing as the number of prescriptions written, as that rate goes down, we're seeing people turn to the illegal drugs, often laced with fentanyl and much more deadly. And I can tell you that if you don't work in this field, I am a nurse with a master's degree. I taught psychiatric nursing, worked in a psychiatric hospital for several years before I became an educator. And if you don't work in the field, you don't always understand it. And so it's important that you know your legislator, that you know your state senator and your state representative. We make decisions about how much money goes into the budget and where it goes, and deciding which programs are important and whether they're doing well or not. And one of the ways that we hear about those and make those decisions is what we hear from people out in our communities that are working in these areas, that they tell us their success stories, that they tell us their frustrations, either a lack of funds or how something is working and maybe money needs done. So I hope that, especially when we're out of session, that you will make a point to call up your legislator. You really can do this and say, can I meet you for a cup of coffee? And you introduce yourself, tell them who you volunteer with or who you work for. And, without asking for anything, just tell them about your program and how you're trying to make a difference in your community. Then, when we're back in session each year, if there's a problem or you're trying to, somebody says there's a way to maybe get some funding for a program, you without lobbying, you can just call up and say, I think that would be a really good idea, to a person that you already know, that your legislator. I can tell you, once you've had a cup of coffee with somebody, you tend to remember the people that you've had a chance to sit down and talk to. So I would say to you, one of the first things that I can, and the most important things I can encourage you to do, is to get to know the people that represent you under the gold dome. So often we hear about the bad things that are going on in our communities, and we don't hear about the successes. And we need to hear about the successes. The young people that have been helped by a certain type of program in, conquering their drug addictive problem, or the young adult that was getting addicted to alcohol. Now, of course, one of the things I keep worrying about is that as we open up medical marijuana, and I know that's what we're only going to do now, and start to grow it, that we may have an explosion in people addicted to marijuana. This pandemic has really caused all sorts of kinds of problems. I don't think that's really good English. I think I'm tired already this early in the day, but we are seeing so many more drug overdoses, suicides, just all kinds of mental health problems. People relapsing from being off alcohol. It has really, really upped the antics on the number of people that need help across Georgia. So once again, thank you for everything you do to help us try to prevent the young people and young adults in our state from becoming addicted to any of these abused drugs, alcohol, smoking, the kind of things that are going to be detrimental to their future and their health if it's not lethal to their future and their health. So thank you so much. I appreciate having a few minutes to talk to you, and I wish you the very best in all your endeavors. I'm available to talk to people anytime. You can find my name. It's Sharon Cooper. And just let me know if I can do anything to help in the future. Thank you.
Dr. Greg Ruduka is the Program Director of Voices for Prevention for the Council on Alcohol and Drugs. The evidence-based substance abuse prevention programs he designed, directed, and implemented have served thousands of Georgia's parents and children since 1987. These programs, rigorously evaluated by several Georgia universities, won 7 national awards from the U.S. Substance Abuse and Mental Health Services Administration.